Blessed people of the world, geriatric nursing is as important as child health care. It's very important to take good care of our old, aged parents, protect them and prevent them from injury, make them happy and elongate their lifespan. On this note, I'm welcoming you to my YouTube channel, Talking Health with Grandpa. Today we are going to focus on 25 steps of caring for our aged parents. Number 1, safety and security. It's very important to see the safety of our parents. Our old aged parents need to be kept safe and secured so that we don't expose them to hazardous situation, or we don't expose them and let them be injured. Number 2, physical care. We need to care for them physically, support them in whatever they are doing, even in taking good care of themselves. In the bathroom, you give them assisted bathroom bath. We support them. When they are moving from one place to another, we make sure our eagle eyes on them and we go closer to them so that they don't fall. It's very important. The hygienical care of them in terms of bed bath, cleaning of their mouth should be paramount to us, and we should support them. In some occasions, because of their age, we need to collect all their dresses, their clothes, their beddings, and make it so tidy, wash it, if possible, iron some of the dresses they are wearing so that they look neat and happy. So we show them love, which is very important. In terms of hygienical support, personal hygiene, environmental hygiene, and even food hygiene. I'm coming to that. So they need physical support. And when they are moving from their house to somewhere else, we need to assist them and support them so that they don't fall. It's very important. Dietary care is very important. When people have become old, they don't take much food, but they need care. So we need to prepare a delicious, easily digestible, nutritious diet for them as their choices, and protect them and present it to them in a loving, friendly manner, and even sit with them when they are taking their meal. Crack joke with them, make them happy, and they will be able to take their meal according to how they want it, and you observe closely, they eat well. So also, let them be taking water, adequate water intake, like 4 to 5 liters in a day, because elderly people at times become dehydrated because they don't have that stimulation from the central nervous system that, I'm thirsty. So they might ignore it, and they need water. So let them take wholesome, drinkable water, at least 4 to 5 liters in a day, at least to refresh them, to rehydrate them, so that they won't be dehydrated. The psychological care, we need to encourage them, because during this period, they will be thinking that, my children are somewhere, my property somewhere, the money in the bank, and all whatnot. So who will take good care of those children? Who will take care of the company? Who will take care of the money in the bank so that it won't be stolen away? All these, many things will come to their mind. And that is the reason why we have to encourage them, allay their fears, counsel them, and give them word for encouragement to make them happy. So it's very important. the psychological care of our old parents should be paramount to us. So we should have time for them. Environmental care, the environment where they are must not be injurious or hazardous to them. We make sure wherever they are moving to, wherever they are residing, is free of injury or hazardous property. So also recreational activity is very important. We should have time to sit with them, to crack joke with them, to let them go into recreational activity like playing Ludo, telling stories, playing draft, and even if you are playing Ludo with them, let them beat you, let them win you, let them win you. So this will encourage them. They will laugh, they will give them applause, and you encourage them, they will be happy. And all this psychological care that you are giving them in terms of recreate with them, you allow them to do some mild exercise like walking. You walk, I see them, you walk along the corridor, you walk within the compound, and if need be, they can walk outside in the evening, and you support them so that they will be active. There won't be any boredom. Don't isolate them. So also bowel care is very important. We should be able to know, are they urinating well without pain? Are they having any pain anywhere? Are they defecating well without pain? Is there constipation? Is there diarrhea? All these need to be asked, to be observed. And it is when you are very close to them and you are friendly with them, you can do that. They need it. Then sleeping pattern care is very important. Our elderly people, because of the stage they are, they might not sleeping well, and so we have to have close observation on them. Are they sleeping well? When do they go to bed? Then do they wake up in the night to urinate? And when they back to their bed, are they sleeping soundly? Then all these need to be observed. And if they are not, and that is the reason why you have to open a sleeping pattern chart. You can open it for them. That one will guide you to know whether they are sleeping soundly at least 7 to 8 hours within 24 hours. And if not, you should be able to correct it either by taking them to the doctor, by counseling them first, by allowing them to ventilate their mind so that they don't have anything that is bothering them that did not allow them to sleep soundly. And even the sleeping arena, their bedroom should not be stuffy, should not be too cold. There shouldn't be any noise. The beddings should be neat. There mustn't be any irritation, something that will be irritating them on the bed, or smoke of maybe generator, or any sound, music playing somewhere that might disturb them. All these need to be taken care of. So also eating pattern charts should be open for them. So you'll be able to know, are they consuming food well? Are they eating well? Don't just have food for them and leave them and go away. They might not eat it, and they might eat little, and you will not know, and they become emaciated. So please, we need to be close, very friendly, very lovely to them at that age, regard them and assist them, support them, and make sure they are eating well according to the choices of the food they want. Then close observation also is very important. What I mean, every family is encouraged. I encourage every family to have at least BP apparatus, clinical thermometer, that you can use as a first aider to check the blood pressure of your elderly one, and to know the normal, the abnormal, or the subnormal. And if you detect anything, you can easily contact their doctor for perfect treatment. So also, you check them and record it So it's very important as part of geriatric nursing care, or what I can call family care. If they are not in the hospital, it has become family care. Though nurses can also go there at interval, but the family also should be able to do all these things I mentioned in love. So also visual assessment. Our elderly, because of the stage they are, some of them might not be able to see well. They might not be able to differentiate color. They might not be able to even identify some objects that could be injurious to them. So also we have to assess as part of nursing care or family care, as the case may be, to make sure that we assess their visual acuity. That is, are they seeing well? Is there any complaint in any of the eyes? If there are, then you encourage them, you counsel them, you reassure them, and you take them to optician who can at least take good care of that issue. So also memory assessment is very important. When you have time with them and you love them and you care for them, there will be a time you sit down with them. Daddy, how are you, sir? How is today? Crack joke with them. Can you please tell us some of histories about our story, about what you've done during your adolescent life, when you are in university, when you are in primary school, when you are in secondary school, even before you marry? How do you manage to toast our mother, our mother? You are very lucky. Can you tell us some things? You are trying to assess their memory faculty to know whether they are able to recall some, whether they have short-time memory, long-time memory, or everything is perfect. And if there's any defects you noticed, then you take them to the hospital for treatment. Then object identification is very important. You should bring all things to them for them to identify. That is how you will know that, oh, daddy can identify needle, daddy can identify electric apparatus, daddy can identify where the stove are, daddy can identify even gas, daddy can identify this and that. So that if by virtue of the age they are unable to identify all those things, then you encourage them and you move those things that you think might be hazardous or injurious to them away from their contact. So also hearing ability, you have to talk to them to know which of the ear is the two ears are functioning well. Is there anyone that is defect? Then if there is any, either by calling them in a low voice if they react or respond, or by calling them by shouting. Maybe by shouting is the one they hear, then you will know that there is something going on in their ear that might not allow them to hear you when you are talking to them. So all these need to be assessed, and it is part of the nursing, geriatric nursing care, and I can even say family care. So also you prevent isolation. Prevent them from being isolated. Don't isolate them. Don't let them be isolated, so that they won't be sad, and from there they can be depressed, because when they don't see anybody with them, they don't see anybody talking with them, they don't see anybody gisting with them, then such an elderly person could be sad, could be depressed, could be thinking that, oh, they've neglected them. So don't neglect them. So also prevent wandering tendency, because most of the old ages people, some might not be able to recognize their pathway, the ways they can move out, and because of age they might not be able to know the way back home. And that's the reason why we need to guide them. We don't allow them to move out to streets or to roads alone. We need to support them and assist them so that they don't miss road and become wandering. We have seen many history or story like that people, old people, move out to do some work exercise and they don't know how to go back home again. We shouldn't allow that. We shouldn't allow them to wander away. We should give them time because they've given us time. So it is now our own time to give them time and care for them in love, care for them friendly. Financial support is very important. Like retired people that have retired, some of them might not even get their bond. Some of them might not be able to receive their pension on time. And there might be some situation whereby doctor will prescribe some medicine for them, they don't have money. We have to support them financially. Not only that, if they need something, they want something like fruits or something they want to eat that they like or love to eat, then and they don't have money, they become sad. They be thinking that when I'm agile, I have money in bank, it's not with me now. I want to take this, I want to have that. So at times they might not even have that money. So we need to support them financially. That is part of the nursing care, which I can still say family care as well. Then we open suicidal caution chat for them. What do I mean? If we listen to their utterances and we suspect that they are having suicidal ideation or they've even attempt, then we should be very careful to go closer to them, to counsel them, to encourage them, to reassure them, and make sure we put our eagle eye on them and we open suicidal caution chat and we monitor it so that they don't go and commit suicide. It's part of care. Then we encourage them on religious activity. It's very important. You can allow their religious friends either from their mosque or from the church to come and interact with them at home. At times, if the strength is still there, you can take them in your car and take them to the church. Let them sit down, listen to the word of God, listen to the sermon, dance when choirs are singing, and at least interact. Psychologically, emotionally, they will be happy that at least they are contacting their creator, and by virtue, friends from the church, friends from the mosque can pay them visit, as they also can pay their friends in church, pay their friends in mosque that they are friendly, pay them visit on your supervision, on your assistance. It's very, very important. So also, periodical medical checkup is very important. It's very important. It's very important. So let's have time for them so that we take them to their doctor. Even if there is no complaint, let them go and see their doctor. Their doctor will assess them, they observe them, they will encourage them, and even if there are any medication, either they can ask questions from the doctor. Is this medication? Could they continue? Could they stop it? Could they reduce it? You see, all these interactions elongate their life and they become very happy and they be having a very sound health. So it's very important for checkup. Then never and never, I beg, never neglect your old parents. Never neglect them. They've served us when we are young, so we have to serve them. We reciprocate with gesture, with love, be friendly. So we need not to neglect them. So if you neglect them, you are causing much damage than good. So never neglect your aged parents. It's part of care that you need to give to them. Never bully on them. They are once very active, very intelligent, very passionate, are very, so, but now when the old age comes, things that they have been doing either for you or for themselves, they might not be able because of old age. The old age where all of us will definitely pass through as ordained by our Creator. So don't bully on them. If you want to do something for them, if you want to ask questions on them, from them, if you want to guide them to somewhere, don't bully on them and don't insult them. Don't bully on them, don't insult them. So be so supportive, be so friendly, even more than before. Be so loving to them, and that will bring joy to them, and they won't be able to be having a kind of a depressive episode, or becoming sad and being agitated, irritated, or aggressive. So it's very important. To show them love and pray with them. Pray along with them. Always show them love and pray along with them. Now that we have GSM, even if you are not around for some short period, and you make sure that you put them in a very good care of somebody who have passion that we care for them, then continue calling them, hello, daddy, how are you? Hello, mommy, how are you? How are you feeling? Have you bathed this morning? Have you take your diet? Have you bathed? Have you been to toilet? How is everything now? So try as much as possible to show love to them, and be friendly with them, because their old age, they need love, they need support, they need to be assisted and back up. So also it's very important you make sure you show them love and you pray along with them. Then engage them in dancing therapy. Number 25, engage them in dancing therapy. Yes, when you are around, allow them to choose the type of music they are interested, the type of dance, the type of music. Is it reggae? Is it apala? Is it Fuji? Is it juju? Is it all these beautiful musics? You ask them, daddy, even during your wedding, whatever, who came there to play? Which type? Is it Bob Marley that came? Is it Peter Tosh? Is it Majek Vashek? Is it Orlando Owo? Is it Sunny Ade? Is it Obe? And so on and so forth. Then, which of the music do you want us to play for you? And you assist them there. Then you play the music, the home theater, and you dance with them, and allow him to win, to encourage him. Don't say, daddy, I dance more than. No, allow, even if you dance more than daddy has danced more than you in those days. So please, dancing therapy is part of the nursing care and family care of geriatric people, that is old people. They need all this. So please, ladies and gentlemen worldwide, let's take good care of our aged parents. Never neglect them, never bully on them, never shun them. Have your eagle eye on them, support them psychologically, physically, mentally, financially, morally, spiritually, and let them feel happy, let them feel comfortable, so that where they are focusing, they will be happy to go there when the time comes. Never allow them to be sad. Don't put them into sorrow. Don't put them into pain. Don't neglect them. Have very close observation, friendly, lovely, caringly for them. And all this also will elongate their life, and they'll be happy, and they will pray for you. Thank you very much for listening to my preventive health today, Talking Health with Grandpa. Always subscribe to my YouTube channel. View it and comment on my YouTube channel and share to others to benefit. It's preventive health. It's preventive health. Share to others far and near to view it, to listen, to take good part of, take it and use it for their benefit, and also to subscribe and comment on it so that we will know where to put on more effort. So geriatric nursing care is as important as child health care. God bless you. Happy day.